Dr. Lewis-Ragland, I am so excited to have you here with us today. Thank you so much for showing up.
Sorry for the technical issues.
No, I mean it's confusing. I mean, technology is great that it's like helps us connect from all of these locations, but I am kind of managing my own schedule and technology these days, and I probably could be clearer. So I apologize for any confusion. Would you mind doing your own kind of introduction so I don't sound overly formal? And then I'm gonna shut my camera off and give you the floor. Oh, actually, I need to make you a co-host too so you can share your screen. Yeah, okay.
Okay, well, thank you, Mandy, for even, inviting me into this space. Thank you all for your attendance today, for your attention today, and just for being open to receiving this information and just doing the work that you do. So anytime that I'm able to share in this space of, in encouraging and increasing inclusion and belonging, and dealing with justice in terms of health and health equity, I'm very appreciative. So my name is Dr. Yolanda Lewis-Ragland. I am a pediatrician at Children's National Medical Center. I work in Ward 8 and live in Ward 8. Of Washington, D.C. I've actually lived and worked and served that community for over 20 years. I'm a mom of three wonderful children, almost all adult children. Yay for me. My youngest daughter is graduating from high school this year on her way to college. And I'm also a director of health equity and community impact for Harlem Festival of Culture Foundation, and doing some other work in the DEIJ, and I always add B as in belonging work. So I will start to share my slides because I know we don't have a lot of time and you guys have some things that you need to get to. So we'll start right away. Sorry that it wasn't already queued up, but let's see, yeah, there we go. All right, so basically, and because I have all of this stuff on the screen, I just kind of removed it all. All right, so we're talking about building culturally confirming care. And what does that, trying to advance slides, sorry. Okay, so 3 learning objectives, just to define some terminology. They're not all on here, but a few things that I was asked to talk about was what is cultural humility, cultural responsiveness, cultural appropriate care. Describe maybe what culturally appropriate care looks like for patients who do not speak English as their native language, and then describe an organizational culture that prioritizes the social needs of patient population. So no disclosures, financial or otherwise, to that I have at this time. And then I just want to start with what I consider a self-awareness exercise. So real quickly, so we're all culture-bound individuals. We all participate in multiple cultures, and we all carry our cultures with us at all times. This is the reason, and the fact that we do this has an impact on how we view and relate to other people. So one of the things to understand is our cultures determine our behavior. And I want you to think for a moment before I really get into this about what are some of the cultures that you might belong to? And I really want you guys, you can go ahead and throw some in the chat. I can't see all the chat, so because I'm sharing, but wanted to see, open it here. There we go. So what are some of the cultures that you think, you don't have to do this on a piece of paper. When I do this in person, I do it on paper, but throw a couple of cultures that you think about, or that come to mind when I ask you what cultures are you a part of. Let's see what anyone comes up with. Anybody think of any cultures they belong to? Let's see. Now I'm looking at the chat, but I don't see anything. Am I able to see the chat? Are there anyone? Okay. So someone has the Black Volunteer Caucus, Indian culture. When you say Indian, are you saying East Indian, Native American? Someone says women, African American, South Asian, Nigerian, African culture, Arabic, Dominican. Okay, these are lots of sort of country bound and ethnic cultures. HBCU grad. Okay, there we go. That's a culture, right? So these are some cultures. What else? Female mom physician. Yeah, so there we are, getting specific about some cultures. And so that's one of the things that I actually wanted to hit on. How many of you surgeon cultures, right? How many of you have a Peloton? All right, there's this whole, like, I have a Peloton. This is a whole thing, right? Peloton culture, when, you know, people talk about, you know, doing certain rides, or if I will post about somebody, a very specific instructor, and I say something about Tune Day. Everyone who knows about Peloton and the app or the bike knows who I'm talking about. You have scientific cultures. And the thing is, we have the mom culture is a whole thing. There's actually subcultures and mom cultures. I'm now an adult mom culture, right? When I had little kids, the people that I talked to about my children, we were always talking about some very specific things, right? Either breastfeeding, or we were talking about, you know, weaning, or we were talking about, you know, looking for nannies, or looking for babysitters, or looking for the daycare, or what schools. And you're looking for, you know, primary schools. But we talked about a lot of the very similar things. Now that my kids are grad school and older, women's organizations, now that my children are older, I am in a different subculture of being a mom. Because now I'm talking about things that either they're, you know, in college, or going to college, or working. And the reason I wanted to bring this up is because we share a lot more cultures than we recognize. I think sometimes we think very specifically about our ethnic cultures. And so we tend to really sort of separate ourselves a little bit more. But when we start to recognize that we actually belong to several subcultures, I'm HBCU grad culture, as well as a mom culture, as well as, right, people are a lot more similar than dissimilar. And these are, when you start to see your connections and recognize your connections and your interconnections with other people, then we can actually decrease otherism, and we can and recognize ourselves in others, and them and us. And I truly believe that it's sort of our responsibility to think bigger, and recognize that globally we have so many more cultures that we belong to together, especially within the country of America, right? We really do share a lot more cultures. So I just wanted to start with that. I can close this chat now, but thank you guys for participating. But that's just one of those things that I think that a lot of people don't really think about. And when we're in person, we kind of discuss those shared cultures. So cultures, we have only a few here. This is not an exhaustive list by any means, but you have age and generations. I may be 52 going on 53, but I'm Gen X, right? My kids are millennials and, you know, going into Gen Z, boomers. We all have, you know, you have your age, but then you have your generation. You have cognitive limitations or abilities that actually separate you into some different cultures. Your country of origin, we had a lot of people that were talking about their country of origin. Degree of assimilation once you're in a country. Your education. Someone said HBCU grads. There's a difference between PWI, which is your predominantly white institutions, and your HBCUs. You just have a different experience. And I got to experience both undergrad and then grad school, and they were very different. And they just had different cultures, environment and surroundings, family, household. And there's just an exhaustive, this is a list, but it's not even exhaustive, right? This is just some things that we want to think about. But health practices, whether people do yoga, Reiki, acupuncture, occupation, and then perceptions or beliefs about diet, nutrition, political beliefs, physical abilities, racial ethnic groups, religion, residents, socioeconomic. And the one that I skipped over, but that's in red, is the one that we're focusing on today, and that's language. And even within language, there's lots of culture. You know, there's spoken language, there's written language, sign language, dialects, literacy levels. These are all subcultures within just how we see language as a culture. But the thing to remember is that when we talk about culture, there is the surface level. That's the stuff that we sort of see, that we really know about, that we recognize. Maybe if we're looking at a culture, especially with ethnic cultures, we're looking maybe at the food and flags and festivals that you might have seen or participated in, performance and dance, games that are played within that culture, arts and crafts, literature and language. Again, this is the obvious stuff, the things that we sort of recognize with our five senses. And that's about 10% of what is actually a part of that culture. What's under the surface, that deep culture, the stuff we don't really see that's hidden, that constitutes about 90% of really what that culture is made up of. And it's things like communication styles, facial expressions, gestures, whether or not in that culture eye contact is permitted or even encouraged, or sometimes not encouraged between genders, or not encouraged in age groups, right? So young respecting old, you know, how do you interact with your body language, conversations. One that I really like is personal space. Quick story. I was a Peace Corps volunteer before med school. And in the Peace Corps, I went to West Africa. I was in Cape Verde, had a great time, amazing. 3 months of training, and then you get dumped into your city. And I had a wonderful time. But what I did when I first got there is I recognized that, you know, there was this whole issue with personal space. I was very aware that there was a difference in culture in personal space. We'd gotten on like their auto bus. They have like it's like they call it a yas, but basically it's a minivan, and it was sort of the public transportation. And the first time I got on one to go into the city, a woman gets on after me and she hands me a basket, and the basket had a live chicken and all of this stuff. And she was on her way to the market. And as she got in, she was handing all of these people in the van, like just some of her goods. And everyone was happy to just hold her things as she went to the market. And she was sitting so close to me, almost sitting on me, but it never took her basket back, by the way, because she had so much stuff to bring. And culturally, everyone in the bus was just one of those things you did. You just sort of helped each other out. Well, I was there for 2 years. I got really comfortable. In fact, I adapted their personal space or their lack of personal space. And I finished my 2 years and I got accepted to medical school, got to Howard. And then the first few months, I would notice that I talked to people and they'd sort of back up. And I really hadn't noticed it in the beginning, but after about 2 or 3 months, I realized it. And someone pulled me aside and actually said, you know, I'm not sure if you're aware of this. They actually had to remind me about the fact that I was sort of violating their personal space. And I had to laugh at myself and recognize that I had become culturally, I had adapted this very close way of sort of communicating. You know, they would hold my hand as they talked. Within the whole 2 years, I came back and I was actually, I had adapted, and I had to readjust and get back into the American way of doing things. But this was just something very, very simple that I recognized, that I actually experienced and recognized. And that was just my communication style. But there's a lot of things in here, self-time, fairness, and just this concepts of past and future, roles that are related to age, sex, class. You have notions of courtesy and manners, attitudes toward elders. There's a lot of stuff in here, and these are all parts of culture, religion, courtship, marriage, and sometimes we will impose our own cultural views or values onto others, and we have to be careful of doing that. The other thing to know is there are things that affect these cultures that influence, right? So climate, geography, demographics, economics, media, education, ideology, and religion can all affect or somehow have a rather can shape some of these deeper aspects of culture. So the landscape in America is rapidly changing. This is a concept that we talk about all the time. And it's important to know that by 2050, the US is projected the demographic makeup will be 47% non-Hispanic white, 29% Latinx, 13% African American or Black, and 9% Asian. Currently, approximately 20% of the US population, which is about 58 million people, speak a language outside of their home, in the home other than English. And 9% of that 20% have also a limited proficiency in English. The thing to know for us is that there's legislative, regulatory, and accreditation mandates that require us to adapt and understand and make some adjustments so that we meet the cultural and linguistic needs of all individuals, and specifically these that are being left behind. So culturally responsive care involves some things. Cultural humility is one. We'll define that in a second. Cultural intelligence, I'm not sure if you've heard it, so I'll talk about it briefly. Cultural fluency and cultural competence. A lot of people have heard of cultural humility and competence, but it's cultural intelligence and fluency that really sort of shapes those two things, and they all affect each other. So what is humility? Well, humility in general is just an attitude of modesty that comes from an understanding that we are a part of a larger issue, right? A larger view, a larger space. A lot of times people think of humility as feeling you should feel or think of yourself smaller than you are, and that's not the case. Actually, it's the opposite of that. You can be as big as you need to be. You can think of yourself as big as you need to think of yourself. Just understand that in relation to the whole, there is a bigger picture, and that's what we're trying to accomplish here. Cultural humility is a process of learning that respects that there is a meaningful exchange that is bi-directional, that we as providers don't have all the answers, that there's also some learning that we should be able to do, and we should be doing this at all times. And it requires continual engagement, self-reflection, and self-critique. And it's designed to address and repair power imbalances. And then it also encourages practitioners to develop partnerships with people in groups who advocate for others. So cultural intelligence itself is just the ability to learn information correctly and apply the lessons in situations. And I say correctly for a reason, because you have to correctly apply. Just getting information is one thing. It's applying the information correctly that makes it intelligence. All of us have been test takers in med school. You got all this information that you've learned. And sometimes the question asks you everything you already know. Like it really states everything you're thinking. Well, what do they want to know? Because it's everything that I was ready to answer is in the question. And you understand something when the way the question is asked, the options that they give you, they're really teasing out whether you completely understand the concept. And so that's what separates those who do well and those who don't. Cultural intelligence, sometimes referred to as CQ or cultural quotient, refers to the skills to relate and work effectively in culturally diverse situations. And basically empathizing and actively working to understand customs and norms and cultures outside of your own. Then we have cultural fluency. And you see here, there's all types of things that make you fluent. You're listening, you're speaking, your ability to read and write within a language, that determines your fluency. So it's just an ability to communicate effectively, right? So when it comes to cultural fluency, it's the ability to recognize and develop sensitivity to all forms of communication of a culture. And that's very important because, again, we talked about this before, in those deep under the surface on that iceberg, there's forms of communication that might be body language. It might be some gestures. It might be whether or not a person needs to have space between genders, between stations, between age groups. There's a lot of things that sometimes you have to really be paying attention to, understand the context of different behavioral norms, engage appropriately. Cultural fluency also involves being aware of what's considered sanction etiquette within various cultures, from body language to physical contact to eye contact. When it comes to cultural competence now, basically the attitude is willingness to value the importance of others, right? Other cultures in your delivery of your services. Competence, as you see, involves attitude, knowledge, and skills. So that's your attitude. Your knowledge is just the learning that allows the healthcare provider the ability to understand, appreciate, and work with individual cultures outside of their own. And then the skills that you apply are usually trainings that enable you to increase your understanding and your appreciation of cultural differences and similarities, and then improve. Always the idea and the understanding is that by doing these things, it will improve your delivery of services between cultures. So what is culturally responsive care, medical care? Should lead to cultural proficiency. So medically competent care that is adapted to meet cultural specific needs of individual patients. And it's a feedback loop, right? It's something where it's not one time, it's not something you just meet this proficiency and you've done it. It's a feedback loop that includes listening, probing, making sure that you're finding out, are there some things that I don't know? What's some information that I need to sort of take account of, be responsible for? When you're hearing certain things from an actual patient, restating it to make sure that they understand, that you understand what they've told you, clarify, following up, and then continuing to participate in that feedback loop. Making sure, though, that you're using the right tools. Oftentimes that may and obviously involve an interpreter, and we'll get to that. But this is something that is really important to understand, is that there's a difference, and this is a continuum of where we have been in the past and where we're moving to, right? So there was a time under cultural deconstructiveness where it really involved just understanding the dominant group. And there's really no concern for other cultures when it came to how we did our delivery of our medical services. In the beginning, it was not even women were not a part of that, right? So a lot of assumptions were made about female and women's care. Many of our women's doctors at the time, OBGYN, things like that, weren't even women, they were men. So there are a lot of assumptions being made. And then there was the incapacities, and went to cultural blindness, where we're all the same, we're given the same care. And then we've moved into recognizing that people are different, and recognizing that cultures are different, and recognizing that our care needs to be patient-centered, moving into competence and then proficiency. And the early stages were really compliance-based. Tolerance for diversity, just recognizing that we need to probably do some things different because there's some regulations out here that say we do. But we're really trying to move into spaces where transformation is for equity. And that's when it's driven by the institutions, driven by individuals, right? Driven by our desire to do better and give better care. So that's where I believe that we are, especially when you're doing trainings like this is where we are. We're really trying to transform our services so that we can build equity and increase equity. But so this is really the importance of cultural responsive care. It is about health equity, achieving health equity. And it's the centers and values the provision of quality, comprehensive care, prevention, diagnosis, and treatment of health conditions that are prevalent in the vulnerable and underserved communities. It helps identify, address, and eradicate health disparities, which include populations experience an increased burden of things like a difference in your rates of disease, a difference in health outcomes, a difference in healthcare access, and a difference in treatment. These are the health inequities and the disparities that culturally responsive care can actually close these gaps. Right now, this is just a quick map of the fact that we just have a long ways to go. This blue represents those areas that have right now either legislation that requires or strongly recommends laws that that require cultural competence training. The red are the states that are still under consideration for recommending or mandating cultural competence. And then the yellow are the states where cultural competency laws have been vetoed or just died in committee. And we're not surprised at some of these spaces that are yellow, especially with a lot of things that we hear there's going on in the news with things like, education, parts of education that have been ignored or books that have been banned. We're recognizing there's a lot of spaces where cultural competence is going to be a long ways coming. So now there's this enhanced definition of culture, right? So we were talking about what do you think is culture? And we started off, a lot of people were thinking about ethnicities as in culture. And then we started recognizing maybe there's some other cultures that have to do with age and our gender, even some of the things that we participate in on a regular basis. And then we talked about language. And so there's this enhanced idea that linguistic groups really need to be recognized as a part of what culture looks like, right? And so there's this new definition, or not new, but an enhanced definition that I won't even read because it's on the screen. You all can read very well, but it's really, the whole idea is that it started to include linguistic groups. And so what class is culturally and linguistically appropriate service. And there's some standards that have been applied. And so the idea is to recognize that the perpetuation of health disparities are often a result of miscommunication and incongruence between patients' cultural and linguistic needs and the services that have been provided by them. Their studies have shown that this was the case. And so these standards that we're starting to apply and recognizing are a key strategy to eliminating disparities in health and healthcare. And the Joint Commission and National Committee of Quality Assurance has created accreditation standards to improve communication, cultural competency, as well as patient-centered care and provision of language-assisted services. Culturally appropriate care, let's see, where was I? Sorry. There are ways that we can do and provide better service when it comes to this linguistic concerns for our patients. So keeping sentences short and simple, maintaining appropriate eye contact. I can't say appropriate enough because there are some cultures where actually getting eye contact is not appropriate. So understanding what cultures you participate, what cultures that you're interacting with, and knowing when it's appropriate and when it isn't. Speaking slowly, especially if there's a difference in language, is very important. I know I'm a fast speaker in English. So when I talk to individuals that English is not their first language, I speak a lot slower. And I also obviously get someone to help out if they have a family member with them, and especially a younger family member that tends to be bilingual. Sometimes I'll use the family member, or obviously you'll get an interpreter. So being mindful of body language, apply cultural context, get an interpreter involved, please, if you need to. Also, being patient, repeating words and sentences whenever possible. This is a quote that I love by Nelson Mandela that just says, if you talk to a man in in his language, a language that he understands, rather, this goes to his head. If you talk to him in his own language, it goes to his heart. When you go out of your way to really, really communicate with people in a way that is dear to them and is their first language, then they recognize that you put a lot of effort in. So what does a organization look like that is culturally responsive? There's actually three parts to that. There's the organization, there's the group, and then there's the individual, right? So organizations that value and center culture appropriately promote and invest in the following for their individuals, teams, and their company. They promote an open attitude, and this is from top down, right? They promote self-awareness, awareness of others, cultural knowledge, cultural skills, and cultural skills. And on the organization level, there is policies and procedures and practices, identifying where biases might exist, as well as infrastructure building that conduct accessibility audits. They think about the delivery of services and supports relative to diverse customers. Services and supports relative to diverse customers. And what it says, so leveraging your employee groups, right? You have these groups that we get into that are resource groups that we have for our employees, and we can look at those and leverage what are some of the employee resource groups that are already in place, that we can look at the different cultures, examine mission statements and our values, recruit process and practices that are inclusive, understand where there might be links in the pipeline for talent, higher rates of attrition for women, being proactive, offering professional development, things like this, trainings like this, consider language, provide translation where necessary, and then building a community of professional partnerships and identifying potential disparities. You want to look for communication websites and advertise for inclusion. So all the language across the organization should say that they're looking for and that they support and value inclusion, the practices of hiring and the training practices of the staff that's already in place. It doesn't mean getting rid of staff. It means bringing on staff that's diverse, but training the staff that's already in place. With groups that are already that are encouraged in terms of working groups, you want to make sure you're always team building, starting meetings with icebreakers that raise awareness of differences and similarities. Try to do that today. You want to create dialogue during important months in different cultures. You have different heritage months. Ramadan was last week, and our health center, we actually supported and talked about and really just sort of explored what is it. But other cultural holidays and events, incentivize volunteer opportunities to get your staff involved in different cultures, training and education, guidelines that really talk about being respectful and inclusive, and then ensuring that the teams have the tools that they need and making sure that, everyone's just working together. And individually, there's a lot more that can be done. You can just examine attitudes and values and acquisition of your values. What makes you think the things that you think, right? Has it been hearsay, or is it firsthand knowledge? Recognizing that everything that you think about a culture is not fully is not 100% true about that culture just because you've experienced it, or even if you've heard it, because there are people and recognizing that everyone does not represent the totality of a culture. Just that those one or two experiences are not enough. Learn to value diversity, differences, and similarities. Read, study, and effectively respond to differences. Recognizing that differences are actually a good thing, and that you're learning. Being a constant learner is really important in this full process. Traveling when you can, attending cultural events, and again, joining those employee resource groups that are different than yours so that you're learning about, again, just other cultures, and the cultures are not all ethnic cultures. Observe and listen. I like to end with this symbol here, is this Chinese symbol of listening. And I saw this in a couple of presentations that I've seen. I thought it was an amazing understanding of what listening means, because this symbol incorporates all the parts of what really listening means. It's your ears, that's the symbol that's in orange. It's your mind, you're not just hearing, but you're thinking about what the person is saying. Your eyes are whether you're watching for other information that they're actually giving you outside of the words that are being spoken. So what's the body language? You're giving your undivided attention, and then you're feeling what's being said so that you can appropriately respond. And that's the hard. So the reason we're doing this is because we really want to close the gap on disparities. So we'll end with talking with just re-emphasizing that we want to focus on patient-centered care, learning what makes your community unique, get to know your community's experience, find out what your community needs and how you can meet those needs. You want to as well promote patient dignity and understand that you have a personal responsibility to make connections with your patients and create these partnerships, provide details, diagnosis, and include your patients in treatment plans when possible. And then improving communication is ultimately most important in really understanding what's being said and needed and what needs to be done on your part. So meeting patients where they are and determining their literacy, considering, for example, for young people, smartphones and apps for teens, using pictures when necessary or available, engaging interpreters. Developing cultural competence and cultural humility is ultimately what we need to do to order to place our patients in the center and continue to learn from them. And that is my presentation. So I'm going to go and give you, these are some resources that can be used. And I believe that's at 30 minutes, because we started a little